This news just threw in the last hour that a New South Wales government minister has tested positive for coronavirus is highlighting what's happening with this outbreak in Sydney. It's grown relatively significantly over the last 2 days, and the state's chief health officer is concerned about further unrecognised cases and strains of transmission amplifying through the community. There are some experts optimistic it can be controlled, and the health minister, who is himself now in isolation as a possible close contact, doesn't believe a lockdown will be needed. Reporter David Chow joins us now from Sydney. David, g'day. So the big question is, will Sydney move into a harder lockdown? The health minister thinks not.
Well, that's the billion-dollar question, Joe. And it's interesting to note that Brad Hazzard, the health minister, sounded pretty confident this morning when he said he thinks Sydney won't go into a lockdown. But that won't be within his control. We'll have to see what today's numbers are and tomorrow's and going forward. So it's interesting. Brad Hazzard is now in isolation after receiving an SMS last night, and which he read this morning, telling him to isolate because it said he might be a close contact of a possible positive case. And he was meant to do an on-camera interview with News Breakfast this morning, but the plans had to change last minute and end up being a phone interview, which was broadcast on that show. And let's have a little bit of a listen to what he said.
I think it's a message to everybody at the New South Wales Health Minister can get a text message during the night and wakes up to that. Then obviously we all have a serious issue at the moment with this Delta virus.
Yes.
Not suffering any symptoms, so I just want to stress that it was to do with my workplace, obviously, New South Wales Parliament, and the location and details will be no doubt worked on by New South Wales Health this morning.
And so, David, it sounds like that person who works in the New South Wales Parliament that the minister was talking about there is a fellow minister. What can you tell us about that?
Yes, so in the last hour or so, we did have some news that Adam Marshall, the New South Wales Agriculture Minister, has tested positive to COVID-19. Now, he was one of 4 national MPs who went into isolation yesterday after dining at a restaurant in Paddington in inner Sydney, which is identified as a venue of concern, Joe. So this has really disrupted parliamentary business. So Jodie McKay, the former opposition leader, put out a tweet this morning saying that the sitting of Parliament has been delayed to 10:30 a.m. and staff have been told not to attend. And opposition leader, the current one, Chris Minns, was due to give his budget reply speech today, but he says that's now been postponed because of the unfolding COVID situation involving New South Wales politicians now.
And take us through the latest exposure sites now and the geographic spread of this out of eastern Sydney.
Yeah, Joe, so we've got some updates on some exposure sites. So last night, the New South Wales Health Department put out a notice saying that there are 2 new venues that are of quite particular concern. One of them is in Tropicana Cafe in Darlinghurst. So if people dined in at that cafe on Friday, the 18th of June, between 12 and 2 p.m, as in they had lunch there, then they're urged, they're a close contact, they need to call New South Wales Health immediately to get tested, isolate for 14 days, and even if they get a negative result, they still have to isolate. And another venue of high concern like that is in Bondi Beach, the Ikaria Bondi. So if anyone went there on Sunday, 20th of June, between 5 p.m. to 7 p.m. around dinner time, they too need to get tested and to isolate even if they get a negative result. And few other venues have been identified. So, there's another list, casual contacts, those who need to self-isolate immediately and get tested, but until they get a negative result. And the Darlinghurst Tropicana Cafe is listed there as well, those who got takeaway. So this goes to show that, 10 to 15 seconds of exposure to the Delta variant, it is highly contagious. And that's why the Tropicana appears twice here. And another interesting venue of concern, Meadowbank TAFE, those who were there on Wednesday, any time during the day in Building J, they should also get tested until they get a negative result. And when you look at the New South Wales Health website, which they're urging people in this state to do to get an up-to-date list of the venues, it is quite an extraordinary list now, Joe, with a lot of venues.
Okay, David Chow reporting there from Sydney. So once again today, a key moment will be that release of the figures. This is a bit of a shock yesterday when it came through, and it ended up being about 16 new cases on top of what we'd known of already. So today again we're expecting that figure to come through at 11 o'clock Australian Eastern Standard Time. We haven't got a time on the media conference just yet, but considering what's happening with the New South Wales Parliament and the Health Minister in isolation for the moment while they're sorting out his status, maybe there could be a disruption to that media conference as well, but we'll hear about that later on. And David Chow was just referring to that map on the New South Wales Health website, which shows the geographic spread of this. And it's a really good map if you want to get an idea if you've been to any of these spots of concern. That's the cluster there around Bondi Junction at the moment, and you can see as you zoom in there that it goes to heaps of different sites of concern in Bondi Junction. And if we just zoom back out from that area and show further, so that's the eastern area of Sydney there. If we come out further, you can see that there are, and even a bit further than that, that there are other spots in the west and now the southwest. You see down the southwest to that Hoxton Park area, there are areas of concern there, and that's where that super spreading party was held back on Saturday night, and there were 10 cases that have popped up from that party alone, just highlighting that concern about this cluster, this outbreak moving out of Sydney's eastern suburbs. So if you've got any concern about that, you've been to any exposure sites or you just want to have a look through them, go there to health.nsw.gov.au, and it's a really good rundown of those areas of concern. And keep watching us this morning for that 11 o'clock release of the figures on Twitter from New South Wales Health. That will happen regardless of what happens with that media conference, but we'll be right across that through the day here on the ABC News channel. South Australia's snap border closure with New South Wales has caused confusion at Adelaide Airport, with many travellers learning of the decision mid-air. Reporter Charles Bryce joins us now from Adelaide. Charles, g'day. So take us through what's happened there.
Morning, Joe. Well, it was quite the snap decision. Premier Stephen Marshall made the announcement yesterday around 2 p.m. And it said that it would take immediate effect, which isn't something that we've seen too much of here in South Australia, quite often with border closures in the past. There has been a period of time which would allow people to return to South Australia before those closures do take effect. The closures are no doubt disappointing many people right across the country who are wanting to travel to and from New South Wales, especially with school holidays approaching. There was a flight travelling from Sydney to Adelaide yesterday when the announcement was made. Authorities have said that they will assess those on board on a case-by-case basis to determine whether or not they will need to self-isolate or not, which certainly caused a bit of confusion yesterday. I spoke to a number of people here at the Adelaide Airport this morning, and they're certainly right behind the snap border closure. Here's what they've had to say.
Yeah, if that's what we need to do, there's no point in letting other people in here if it's going to cause problems in this state. We've done such a good job, so you don't want to jeopardise that. The longer the delay, the more risk there is. It's very inconvenient for people, but unfortunately it's just what needs to be done.
I think it's a good idea. The sooner you close it down, the sooner we can get it all clear to go back to normal.
And Charles, SA isn't the only state to close to New South Wales. What's happening with the other states?
Yeah, that's right, Joe. Western Australia also slammed the borders shut to New South Wales, and they did so immediately, but not other states have been as quick. New South Wales have declared all of Greater Sydney a hotspot. Tasmania has, in Tasmania, they've said 7 Sydney local government areas are high risk, while ACT, a state home requirement for travellers from 7 local government areas from Greater Sydney is in place. But once again, Joe, an uncertain future lies ahead.
Adelaide. Queensland has recorded a new case of community transmission after a second person linked to a Brisbane restaurant contracted COVID. The 62-year-old man who was at the Portuguese Family Centre at Ellen Grove, That's kind of on the way to Ipswich on Saturday. It says he returned a positive test result last night. He was identified as a close contact of a Portuguese flight attendant who visited the restaurant while unknowingly infectious. The man has been in isolation and alerted health authorities when he developed symptoms yesterday. And we've heard the Queensland Premier Anastasia Palaszczuk refer to that group of people previously, and she sounded pretty confident because everyone had been identified pretty early and been put in isolation that there wasn't going to be any further spread from that particular incident. So despite the fact that there's been that one extra case there today, hopefully there will have been no further transmission from that person. We haven't got a time yet on the Queensland media conference today. Yesterday it happened around this time, but we'll bring that to you live when Anastasia Palaszczuk steps up. Victoria can look forward to relaxed coronavirus restrictions, which will come into effect at midnight. Zalika Ismail reports.
Victorians will be waking up tomorrow to many more freedoms. Restrictions are easing at midnight tonight, just in time for the school holidays, which of course kick off tomorrow. So these new rules will mean that regional Victoria and metropolitan Melbourne will be under almost the same settings. A little looser when it comes to density limits in the regions, but when it comes to gathering, sport and work, it is the same. So public outdoor gatherings will increase to 50. Visitors to people's homes will increase to 15 per day. The cap on funerals and weddings will increase to 300, subject to those venue density limits, and offices will be able to welcome back 75% of their workers. Now, theatres will also be able to reopen with the 50% capacity limit and a cap of 1,000 people in total, while sports fans will also be back in the spectator box. AFL games will have a limit of 25,000 people and 15,000 for the A-League. But there are still some rules staying for at least 2 weeks. That includes those mandatory masks indoors, and also dance floors will still be banned even at weddings. Now, authorities say these rules will be in place for at least 2 weeks. The state government yesterday saying they wanted to provide a level of certainty for people going into these school holidays. They did say that they will consider easing restrictions soon if the health advisor recommends that. But the idea is that after those 2 weeks, the goal will be to get back to those rules that we had prior to this outbreak when we were incredibly open. We didn't have masks indoors, for example. But of course, that will, as always, rely on the health advice.
Zalika Ismail reporting there from a chilly Melbourne this morning. The federal government has projected the AstraZeneca vaccine will be phased out by October. Political reporter Tom Lowry joins us now from Parliament House in Canberra. Tom, g'day. So AstraZeneca is the vaccine the government's backed all along, but they're now accepting it'll be phased out.
Yeah, Joe, AstraZeneca was supposed to be the workhorse of the vaccine rollout, the vaccine we were supposed to receive, most of us were supposed to receive. That's because it could be manufactured locally, onshore, and supplies were going to be assured as a result. Now, it's important to note here that while the government's now spelling out that AstraZeneca is going to have a much diminished role in the vaccine rollout, that is something we've known for some time. That's because of the new health advice that was updated last week, making Pfizer the preferred vaccine for people under the age of 60. That has just shrunk the cohort of people who are going to receive AstraZeneca quite dramatically, and it's very unlikely we're going to see huge numbers of AstraZeneca delivered past about October. The government released some new documents yesterday that really spell out how the vaccine rollout is going to work from here, and it really lays clear that while AstraZeneca is going to have a significant role to play in that sort of July to August period, the few months coming up, by about September it starts to really drop off, and by October it's only being delivered on request. At the same time, Pfizer really scales up over that time to the point where it's doing the bulk of the work by about October to December. We also interestingly see Moderna along the way as well. It pops up in September, about 100,000 doses being delivered a week, but by the later parts of the year, it's up to around 500,000. And of course, AstraZeneca just drops off altogether. So significant changes to the rollout, but these things aren't unexpected. This just sort of maps out how it's going to work from here.
And so, Tom, how comfortable is the government having to rely on imported vaccines from then?
Well, yeah, as I mentioned, the benefit of AstraZeneca was it can be manufactured locally. It's made at a plant at CSL down in Melbourne, and that really secures our supplies. But if we're going to rely almost entirely upon Pfizer and Moderna towards the end of the year to vaccinate the younger populations, people between 20 and 60, the government's talked about a sprint as it tries to vaccinate this huge number of people. We're in the same boat as most other countries, having to rely entirely upon imported vaccines. And the Prime Minister, Scott Morrison, has been out today saying that, look, while that's not not ideal, it is okay. We are in the same boat as other countries. Everyone's doing this together. mRNA vaccines can only be made by a handful of sort of specialist manufacturing plants around the world, and they're a very reliable supplier. Here's a bit of what he had to say earlier on this morning.
Those mRNA vaccines was a proprietary IP that was held in the United States, and it can be manufactured in Europe. It's not manufactured anywhere else. And so it's important that we secured those supplies. And I've got to say the Pfizer supply deliveries have been consistent with their contractual arrangements. So we're in the same boat as New Zealand. They don't have a manufacturing capability there either for those mRNA vaccines. We're all working to establish those. But let's not forget, when we were talking a year ago, mRNA vaccines, indeed a vaccine for COVID, was almost science fiction. A year on, they're being dispensed around the world, and Australia has millions of them going into the arms of Australians.
Now, today is the last sitting day in Parliament this week, and for quite some time as well. Parliament goes into kind of its winter break and doesn't return until about August. And all eyes, I'm sure, will be on the New South Wales COVID numbers when they come out at around 11 o'clock. That'll be dominating the discussion in Parliament as well, with quite a bit of attention, quite possibly, on the vaccine rollout too.
Okay, Tom Lowry there in Canberra.